Yes, Emily.
Perfect.
Oh, good. Okay, I figured it out. So welcome to our December post-session Asthma and COPD Learning Collaborative. Laura has generously offered to stay on the call for a little bit with us. And so I'm just going to go ahead and walk us through some slides. Tanya, would you mind moving to the next slide, please? Again, the same as usual, please enter your comments or questions into the chat box, and also let us know that your team is here via the chat box. That would be great. Next slide, please. So as I said, Laura is going to stay on the call and be available for questions and reflections. We're also going to look at some of our baseline data. And then I just wanted us to regroup. We did have another hiccup, as all of you know, last month with the cyber attack at the Health Network, and we did end up canceling our session in November. So I just kind of wanted to reset expectations for topics and things moving forward. So we'll do that after we take a look at the baseline data. So next slide, please. And these are the teams participating and the Learning Collaborative participants. Next slide. So I just wanted to open it up for any more questions or reflections from the session that we just heard from Sarah and Laura. And we did have ample time there at the end for questions. So sometimes I feel like we run out of time. So I wanted to add a little space to our post session just to allow some sharing or questions if we had any left from the previous hour. So I'll go ahead and just give everyone a moment to either chat in or I guess you can unmute yourself if you'd like to. Okay, well, I guess we'll move on to the baseline data. It looks, just looking at the chat box briefly, though, it does look like we have a really nice representation from all the participating teams, so I appreciate that. The baseline data. Okay, next slide.
Quick question, Emily.
Oh, was there a question? Great. What was
in the chat box? It says, Laura, in your experience, does congregate housing and businesses do a good job of changing air condition filters?
So that's really going to depend on the specific location. Some do, some are excellent, and some are not. And I think that really comes back to funding and maintenance crew, and do they have an on-site facility manager, and what's their priority? I do think more of those facilities are paying attention today because of COVID, of course. And I can't speak enough to Vermont specific congregate housing locations. I haven't visited enough personally to give you any kind of read on that, but like any building, where the priority gets placed is where the work gets done. And then Karen is asking if I can describe a few of the pilots to talk about Energy Plus Health in Vermont. So I can do that. I'll start my video. So we've got several pilots with hospitals across the state. Up in the Kingdom and in Springfield, we have asthma and COPD pilots where they refer patients to us. We go in, do that comprehensive Energy Plus Health assessment, identify energy and health improvements to make on the home, perform those improvements, and then monitor outcomes. And we're collecting pre and post indoor air quality, energy, and health-related data for those pilots. And those are going to wrap up really soon. And I hope to have a report out next year. In the UVM Medical Center territory, we have been running a pilot for trips and fall prevention, which I know is outside of the scope of this call, but I still think is worthwhile mentioning. And these are for people at risk of falling. We do fall prevention measures at the time of weatherization. That's been really successful, easy, turnkey. Things like grab bars and fixing stairs, putting in, non-slips tape into the shower or tub, or changing out carpet, that kind of thing. And then, as you heard Sarah mention, we work with several healthcare providers across the state to offer a healthy home energy visit referral program where they can refer patients to us. We will do an indoor air quality monitor loan, and then also deliver, at this time, a virtual healthy home energy visit, and then take all those results and send it back to the healthcare provider. And so we were talking about pets before. One of the earlier visits we did, the doctor said, I've been treating this patient for years and never knew that they had a cat in the home, let alone that the cat slept in the patient's bed. And on that visit, the staff person on our end was able to work with the patient to say, why don't you try a month without sleeping with the cat? Can you commit to that? And they did. And so hopefully, if the cat is a trigger during that month, their symptoms will improve, and then they'll be incentivized to not sleep with the cat. We'll see how well that goes. So those are a few of the pilots that we have out in the field right now.
Great, thank you, Laura. Okay, so if there are no further questions or reflections, we can move on to the baseline data. So next slide, please. So this is just a slide showing the measures again. I'm sure you're all well versed in these at this point. So that core measure of screening patients for tobacco use is the one that we've asked all participants to measure. And then we have the supporting measures down below. The supporting measures that are in gray, we did not have any teams select those as something to measure. So the slides that you'll see after this really are on that core measure, and then demonstration of proper inhaler use and screening for those who are having smoking in the home. We did only receive 5 teams baseline data on that core measure, and I recognize that with the hiccup and the inability to email or contact anyone in the health network, there might have been some issues there. So we wanted to still present this data to you and really encourage you to do this baseline assessment on the core measure at a minimum, and not feel like it's too late to participate in that in any way. So we do encourage that. So we will present the 5 teams that did submit data to us, and ask again for you to consider doing the measurement piece of this collaborative as well. So if you'll move to the next slide, please, Tanya. Okay, I'm going to hand it over to Chantel now. We thought it might be worthwhile just to once again review the core measure and the detail on the numerator and denominator for each of the 3 populations. And I'm going to let Chantel do the explaining on that piece.
Great. Thanks, Emily. Hi, everyone. This is Chantel Burke from OneCare. I'm the Quality Measurement Program Coordinator. So I just wanted to quickly go through the example that we put forth as it relates to the tobacco use cessation and intervention sample. As you know, we're measuring on 3 populations. So basically what we've done is we've put together a visual aid for people to really have them walk through and figure out for each population, what are the questions we're trying to answer with the information that we're trying to collect. And what we've done here is we've given an example using actual numbers so that people can see for the denominator and the numerator how that would work, and then what your percentile would be as it relates to your population that you're measuring. So the overall inclusion criteria is patients aged 18 and older, so it's an age cohort measure, who have been screened for tobacco use in the last 24 months. If identified as a tobacco user, they should be receiving cessation intervention. So population 1, really, what is the question we're trying to answer? What percentage of the population were screened for tobacco use? So here we've given you an example of what population 1 would be, using 1,500 patients that would need to be screened, how many patients weren't screened of that 1,500 in the population who were screened. So you take your denominator with your numerator, and it pops out the percentage. So basically, again, for population 1, what percent of the population were screened for tobacco use? So population 1, we're looking for just the screening component of this measure. For population 2, what percent of tobacco users receive cessation? So for here, this population is going to have a much smaller numerator and a denominator because this population is just focusing on of the patients that were screened and identified as a tobacco user, and that's the key, identified as a tobacco user, that's your denominator. Of those patients who are identified as a tobacco user, who of those patients received cessation intervention? And I think, Tanya, if you go one page further, that will be the sample. Okay, so here, population 2, of the 1,500 patients, 1,350 were screened, 500 were identified as tobacco users. So that's your denominator right there. Of the 500 patients, 100 didn't receive cessation intervention, so they're taken out of the numerator. The remaining 400 did receive a cessation intervention. So again, you're at an 80%. So we're just trying to break this down with actual numbers. We've also, I believe, and Emily, correct me if I'm wrong, but I think we've included this visual aid on the Vermont Health Learn website. And if we didn't, I will make sure that it gets put out there this afternoon so that people have this. But we haven't received any questions since the inception of the, when we took the baseline data. So again, we gave you a visual here. Tanya, can you just go back to the first slide? Yeah, there you go. Thank you. For population 3, we're answering the question, what % of the population were screened for tobacco use, and if identified as a tobacco user, did the patient receive cessation intervention? So go ahead, Tanya, back to that third example, please. Thank you. So here it gets a little bit trickier, but we tried to use real numbers. So here we're using still the same 1,500 patients. Your 115 patients who were not screened are taken out of that component. So you then become, you're at, whoops, sorry, I had a pop-up hit right in front of me. Sorry about that. The 1,350 patients were screened. Of those 1,350, 850 patients were not tobacco users, but 500 patients are tobacco users. 100 patients did not receive cessation intervention, 400 patients received cessation intervention. So basically, these numbers are all the same from the previous population 1 and population 2. So here, you're taking your total patient population of 1,500. You're including your 400 tobacco users who received cessation intervention and your 850 patients screened but not tobacco users. So you're getting credit for your screening and patients, and then you're getting credit for your patients to receive tobacco cessation. So we've given you that written out version in the 2 bullet points in the bottom. And again, if there are questions, we can certainly take this offline, but I think this visual helps you with your population 1, 2, and 3, and it'll give you your percentage. And I know that this measure especially can be confusing, but I just wanted to kind of give this visual, and we'll make sure that it's on the Vermont Health Learn. But it looks like the data that we've received from the entities that have submitted it are calculating the numbers correctly between the numerator and denominator for the populations. Next slide, please. So here, we just wanted to share the data with you and just put a little snippet about what the denominator is for the first set of bars on the far left-hand side is population 1. The middle bar set is for population 2, and then for your population 3, it is on the far right. And again, we've included what a quick snippet of the numerator and denominator was for each of the populations. And then you can see that people are actually performing really well in the screening with, there is some improvement in the fourth entity, but again, there's always room for opportunity. And just a reminder, I believe the goal was set at 90% for these measures to achieve or attain, but we know that every practice is different, and there are instances where we won't achieve that 90th percentile, but actually this baseline data gives us an opportunity to see where practices are starting out and where they need to get to. So we wanted to share this data with everyone. And if people do have the opportunity to pull their baseline data or provide us with any data, we can actually see the progression. I think we're doing it, are we doing it on a monthly basis, Emily, or is it a quarterly basis for this?
It's a quarterly basis.
Okay, so it will be great to see kind of the progression on a quarterly basis. But again, here, your population 1 is on the left, in the middle is your population 2, which would have a much smaller numerator and denominator, and then your population 3 is on the far right. And Em, I'm sure what else you wanted to add to that, but is that enough information?
That was great. Thank you, Chantel. So I'll just say all the teams have been blinded and they're just given a letter, A through E. Yep. And as we move to the other 2 slides, the letters associated with the same practice. So as we go through. So great. Thank you, Chantel. Yep. Are there questions on this before we move on to the next slide? Okay, great. Tanya, the next slide, please. So this one is on demonstration of proper inhaler use. We had 2 teams that selected this measure, and neither of them had this documented in their medical record. So room for improvement there. Next slide, please. And we had 1 team that selected the screening for potential smoking or vaping inside the home, and that was around 20%. Next slide, please. Are there any questions on those measures? I'm sorry, before we move on. And again, I do want to encourage you to please submit baseline data if you haven't yet. It's not too late. So these are the dates for the quarterly sessions on reviewing data as the larger group with all the participants. We do have one scheduled for January 27th, but in light of the cyber attack and the pause we kind of had there with the Learning Collaborative, I'm wondering if the group feels like it might be best for us to push that first one back to February. We could do that if everyone on this call felt like maybe they did have some data they wanted to submit and would welcome the extra month before we met as a large group to take a look at this in more depth.
This is Thomasina. Can you hear me?
Yes, I can. Hi, Thomasina, go ahead.
Okay, yep, sorry, I'm having trouble with my headset. So a couple questions. Have we, has OneCare set a project leader yet so that as you transition away from OneCare, Emily, we know who's going to be coordinating folks in the new year around the collaborative?
Oh, thank you for that question, Thomasina. So for those of you who don't know, my last day with OneCare will be tomorrow. We do not have someone identified yet who will be filling my role. My plan is to leave the OneCare help desk email available to those of you that communicate directly with me, and they will triage your questions to the appropriate people. We do hope that there'll be someone identified in the very near future who will be leading this project. But that's as much as I know at this point, and yeah.
Okay, so then I guess to answer the question, I would say that if it's a great external motivator or accountability piece for OneCare to make sure that there's somebody designated by the time we're scheduled to meet in January, then I would definitely recommend keeping the January date. If nobody expects that we will have a new project manager and a point person who can coordinate folks around the January 27th date, then I would say that that may not work.
Yeah, thanks. This is Norm. That's great advice, and we will, as we identify the new leader, we will let people know about the next data sharing opportunity.
Great, thank you.
Okay, great. So next slide, please. So I did want to just leave you with the plan for the next few months as I'm leaving it. We, again, canceled last month. Though it's a great presentation. We've had it set up and reviewed for almost a year now with Amy Yannick on medication management. So I was very, very sorry to have to cancel that in November, but she has generously agreed yet again to be on our schedule for February. So the date will be determined, but in January, you'll be hearing about asthma and COPD action plans on the 8th. And then in February, we're going to plug that medication management presentation back in from Amy. And you'll hear more on the other presenters as they're solidified moving forward. But I did just want to leave you with those next 3 months that are set up. So next slide, please. Again, I wanted to remind everyone who your QI coaches are and who you can contact. Next slide. And I did want to leave you with this email in light of the fact that my last day is tomorrow. So again, for those of you who have been reaching out directly to me, if there's something you need in the short term, use this email address and the operations team will help you get to someone who can sort through any questions you're having. And I think that's it. And I'd just like to say thank you to all of you for participating in this. I hope you continue forward with it. It's a very important work, and it's really been a pleasure working with all of you.
Emily, thank you so much for the time that you've put into this so far. This is Thomasina. There's one other outstanding item that I wasn't able to bring up when we were talking about data, and I'm wondering if I can ask that question now.
Sure, please go ahead.
So when I was supporting a site, again, as a QI facilitator, when I was supporting a site to complete their collection tool, I do look at the most recent version that's on Vermont Health Learn, and I see that despite what was in the slides earlier about those kind of optional measures or the additional measures, there's a different denominator for the question about has somebody smoked or vaped in the home recently in the worksheet, and I wonder if anybody else noted that, and if we wanted to have a discussion about that difference. So the original measure was that the denominator for all of the elective measures would be number of patients with asthma or COPD. But in the worksheet for the has anyone smoked or vaped inside the home, the secondhand smoke question, it changed the denominator to include number of pediatric patients aged 2 to 26, along with adults 27 and above with asthma and COPD, which really kind of turns it more into a more public health prevention measure. And I just wanted to know if any of the other participants had any reaction or inkling around that, or preference, I guess, around how we want to look at that measure as a group.
This is Norm. Chantel, are you still on the phone?
Yes.
Can you speak to us about whether or not the definition that Thomasina is referring to is a well worked out metric, or was this something of our own invention?
No, I tried to turf this over to, I believe it was Karen or Rhonda, because this is one of their measures, Norm, and Thomasina had asked it before, and I didn't hear anything back, so I thought they had followed up with her directly. So I think, let me get some clarification on that, Thomasina, today, and try and get that. I apologize. I thought they had followed up with you directly, so that is my bad there.
No worries.
But I did see that on the tool, and it wasn't one of the OneCare measures, and so I wasn't able to answer the question initially. So I thought by handing it off that would help, but my apologies for not following up on that.
No worries. And Chantel, you were great about following up the day of. It was just unfortunately I wasn't able to follow up within 24 hours after that, and the folks that you kicked it to,
Okay.
I realized didn't get back to me. So I thought it would be a helpful conversation to have with
Yeah.
more folks around to contribute to how they looked at the measure.
Yeah, no, I completely understand that. So let me get some clarification, and then Thomasina, if we need to pull the group together, just have a quick conversation to make sure that everybody's utilizing and accessing the data the correct way, we can make that happen sooner rather than later. So let me touch base with Karen and Rhonda and just get some confirmation, and then I will get back in touch with you and send some information to the other facilitators to make sure that everyone is on the same page, if that's okay.
That works great. Thank you, Chantel, and
Okay.
thank you, everyone.
Absolutely. And Thomasina, just to be sure that I'm looking at the right measure, it's the age cohort measure for the vaping or smoking in the home, the 2 to 26 and 27 and older.
Correct. Yep. Columns N and O in the spreadsheet. Thanks so much.
Yeah, absolutely. Thank you.
And this is Norm. I just want to express my thanks to Emily for her hard work on this collaborative over the last year. I mean, the COVID thing kind of was a huge roadblock, and she stuck with it in very dedicated fashion. So thank you, Emily, and we'll look forward to getting together at our next session.
Thanks, everyone. We're right at the 1:30 mark. So thank you, and good luck to all of you in the future. It's been a pleasure.
I am.
Thank you.
Bye.
Bye-bye.
Thank you.